Good afternoon, everyone. Welcome to our first webinar. My name is Musa Jede. I am a public health specialist with background in nursing. I also currently serve as a data manager at Parthenia General Hospital. I am the founder and executive director of RIHEALTH. RIHEALTH stands for the Resilient Initiative for Health. RIHEALTH is a non-profit organization that promotes resilient communities through advocacy, health education, and preventive services. This afternoon, I am joined by health experts to discuss critical mental health issues. Mental health issues that are very common, but we often neglect them because of various reasons. So our experts today will tell us why people feel reluctant to seek care when they face those issues. Before going any further, I will invite one of the speakers just to introduce himself and tell us where he works and what he does. Mr. Ibrahim Akoli, if you are among the audience, you can unmute yourself and introduce yourself. Thank you. Over to you.
Assalamualaikum warahmatullahi wabarakatuh, everyone. And thank you so very much, Musa, for having me on board. And it's an honor. So my name is Ibrahim Akoli. Currently I'm working at Family Medicine of Edward Francis Multi-Gen Hospital.
We know that these three mental health topics are so interrelated and they are very, very, very common. However, people feel very reluctant to report these issues due to various reasons. So that is why we feel that it is important for us to invite health advocates, experts to explain to people how these conditions are related, and then also tell us how and when can one seek medical attention if they experience these conditions. Many people hear the words stress, anxiety, and depression, but do not fully understand them. So, in simple terms, can you explain the differences between these three conditions?
Thank you so much, Musa, for that wonderful question. So to differentiate between stress, anxiety, and depression, we have to know what each one of them mean. So when it comes to stress, like every one of us, we undergo stress. Although some have chronic stress, some we have acute, but each one of us normally undergo stress. So stress can be divided into two. That is, it is either eustress or distress. So eustress, it is spelled as EUSTRESS. So eustress is the stress that will force you to be productive in life and also to be helpful to others. It continues and then it becomes chronic, and that is constantly released into your body. Then it can even lead to certain health conditions like hypertension and others. So with the stress, if it is not managed and it becomes chronic, then it can lead to depression. So depression is where you constantly feel sad, and also you feel hopeless, you feel purposeless, and these are some of the things that are attached to depression. That is a stress that is not well managed until it leads to depression. So anxiety, like anyone of us can be anxious at a particular time. Like for example, there was a day I was invited at GRS. It was my first day, so when I stood, I was shaking, my voice was even shaking. So I was anxious, but I was able to control myself. So if you are not able to control yourself, then that is a problem. But if you are able to control your anxiety, then that is a good thing. So these are some of the differences. At some point, we all can be anxious, we all can be stressful, but if that is not controlled, then it can lead to a bigger issue, and that bigger issue is what is called depression.
Can you give some of the signs and symptoms of stress, anxiety, and depression?
So some of the signs and symptoms that are related to this condition is, number one, you always feel bad about yourself. You feel like you are not enough. You feel like you have not done enough for yourself and also for the people. And also, you normally, when people comment about you, it affects you greatly. Although to a normal person, when people make criticism about you, when they comment negatively about you, like you accept it and then you move on, like you cope with it. But if you find yourself being greatly affected by that, and you always want to please people, that is, they are called people pleasers. then know that you might be having this condition. And also, you are not taking care of yourself. That is, your health and well-being is not your priority. So that is also another thing. Like, you always appear rough, you wear whatever you feel like, and we normally see this in communities where you will meet with people, and then they will be telling you, "I do not care," or even people will tell you that this person doesn't care, like he dresses anyhow. That is not like they are praising you. That is, it is something that is going on in their life, and then we need to investigate further so that we come to a better conclusion as to whether to help them, or even refer them to maybe like a counselor, or maybe a mental health unit where they will be helped. So normally when we see this kind of people in our communities, we tend to praise them, and that is not a good attitude. So if the person is not taking care of their health and well-being, that is a point of concern, and then we should try to help them. So instead of helping them in the communities, we are always part of the problem. So it is either you are part of the problem, or you are part of the solution, or we are always part of the problem. So and another thing is that, like, even these people, they can be sick, or you want to take them to the hospital, they will always be reluctant. They will be in the denial state that I am not sick, I am okay, nothing is happening to me. So they will be in that denial state until everything become manifested, and then it was evident, and that is the time that they will accept, okay, there's something that is wrong with me, and that is too late. So another thing also, like, if that person happens to stand in front of public, or usually they are antisocial, like they do not want to socialize with people. So if they find themselves in front of the public, they panic. Like, they don't know what to say. Like, I know it's normal that someone who is very shy, whenever they stand in front of the public, they are panic, but they are able to control themselves, comport themselves. But this time around, these people, they are not able to control themselves. They are panic. They cannot say anything. Like, they are sort of words. So it's like they are running away from being judged. So that ceremonies, or even funeral, because they will be like, how will other people see me? How are they, like, going to comment about me? What are they going to say about me? So things like that. If you are very particular with regards to people's comment, then that is something that you need help for. So these are some of the signs and symptoms that we should be mindful of. And also, whether we see it in ourselves or we see it in our loved ones, then we should make sure that we get the right help from the right people.
That leads me to my next question. Where can someone with these symptoms seek medical attention?
So that is important to know. So if you are to tell people about the signs and symptoms, then you obviously have to tell them where they need to seek treatment, or they need to seek counseling whenever they experience those signs and symptoms. So that is very, very important. When it comes to the Gambia, when you go to Brikama, you need to have an outpatient clinic for this patient, this mental health patients. So before, when I used to go there to volunteer, there is this guy called Minte who used to see mental health patients, like on a particular day, like once in every week. So when you also go to Fajikunda, there is someone also there who used to see mental health patients. And also in Carnifing also, they have a unit for mental health patients, and also in MOPD, Medical Outpatient Department of Edward Francis Moore Teaching Hospital. So this is where they see these patients. So whenever they think if they need admission, so they will write referral for them so that they can go to Tanga Tanga Psychiatric Hospital, which is also part of AFSDA, to be admitted. Or if they do not need admission, then they can be cancelled and then given the right advice. So these are some of the centers where one can go to so that they can be reviewed and seen by the doctor. So if still they need admission, then they can be sent to Tanga Tanga Psychiatric Hospital. So sometimes we might think, okay, it's only mad people that go to Tanga Tanga Psychiatric Hospital. Now, even like those that are struggling with their mental health, you do go there, and then you find doctors or nurses that are able to give you counseling. So it is not only mad people that go there, but as long as you have mental health issues, which is not only madness, but like you have relationship problems, you have maybe you lost a loved one, and then it has been always overwhelming to you, and then also maybe you were involved in an accident, RTA, and then that thing keep recurring like PTSD. You can go there, and then they will counsel you, and they will give you a therapy that will help you. So we have different forms of therapy based on the patient complaint. So these are the places that you can go to and then get help, inshallah.
Thank you very much, Ibrahim. Yes, just to add that we have mental health specialists like in many health facilities right now. So if you or your family member or a friend is experiencing something suspicious, you can always go there to seek medical advice. Yeah. So Ibrahim, I just want to know, I'm curious to find out, why do you think people are hesitant to seek medical care when they are experiencing mental health issues in the Gambia?
Main issue here will be they will always be in denial state. Like for them, nothing is happening to them, even though they are manifesting signs and symptoms of those conditions, but they will still be in denial. It's like if someone is dying, like the dying process, you normally have that. So denial is also there. Like you deny that okay, you are about to die, something like that. So these people also they are in denial. So if you are in denial, unless if you are convinced, you will never seek treatment. And also sometimes it is also because they believe that our healthcare system is not good enough to treat their condition. That could also be the issue. Like most of the people, they believe that whenever you go to our healthcare settings and whenever you are seen, you are always given paracetamol, like as the drug. It's the only available drug at our hospitals. So with that long queue, you are seen, you go to the lab, you come back only to be prescribed with medication. You go to the pharmacy and they only give you paracetamol. So this is a stressful situation for people, and then this one has been ongoing. So they will keep cycling while you go there. They only offer you paracetamol and nothing else. But I always advise people, like even if it means going there and then they give you only paracetamol, which is not always the case, because there are like common medication that are available in our hospitals. But even if you happen to be prescribed with, like let's say all those medication and then you get only paracetamol from our pharmacy, then you should thank God. And the reason being is that before you go to the pharmacy, like outside pharmacy, you go to the private pharmacy and then buy drugs, or they dispense drugs to you and you take them. It is better that you go to these public hospitals where you will be seen. They will collect your vital signs. Not only that, they will hear from you your history, past medical history and surgical history, whatever, and they will even probe to ask further questions, so that now they will come to this conclusion that okay, these are the investigations that are needed so that I can diagnose this patient. So the investigations will be written for you to go and do them from the lab, or let's say from the radiology department or wherever, so that when you come with the results, they will analyze the result, come up with a diagnosis together with your symptoms, then they will write treatment for you. So that treatment, if you were not able to get those drugs from the hospital, at least you were able to get the prescription with you. So that is the prescription that you should take out now, bold enough now, and you should take it out and give it to those pharmacies that are outside, and they will sell exactly what is being prescribed, and that is safer than you going directly to the pharmacist and then explaining your symptoms, and they will give you a bunch of medications without running this. Sometimes even the basic test of vital signs, they don't even do that. Maybe they will only check the blood pressure and then they will give you this lots of medication. Sometimes you go there with just fever and, or let's say a common cold, and they will give you antibiotics and other unnecessary medications. So I think they also lack trust in our hospitals. So that is why some of them are not seeking treatment from our hospitals.
So I just want you to just give a message to the young people who are silently battling some of these conditions. What message do you have for them?
Those that are battling with this condition, what I will advise them to do is do not be silent about it. Although discrimination, stigmatization is very common, but do not be silent about it. Make sure you have someone that you trust so much, and someone that you can lean to, someone that you can complain to, and they will not be judgmental to you. Make sure you have that individual so that you can be complaining to them. And then to those people that these people are complaining to, you should make sure that you take it very seriously and make sure that you are part of the solution to their problem and not the problem to their problem. So they say, like it is a common saying, that a problem that is shared is half solved. But I always say this, a problem that is shared with the right people is half solved, but a problem that is shared with the wrong people is a problem that is multiplied. I think this is very clear. So you have to find the right people to share your problem with, then they will come up with solution. They will even advise you where to seek treatment and even when to seek treatment. But if you seek advice from the wrong people, they will not help you. So your problem will keep escalating, and this will keep affecting you to an extent that you can no longer seek treatment for yourself, but it is people that will recognize these signs and take you to the hospital. So another key thing that I want to emphasize also is this substance abuse that the kids find themselves developing, like our children, our youthful generation, let's say push and others. So we need to stay away from these substances. Do no good to us. Like they are harming us, and they will keep harming us as long as we are using them. So as a youth, if you want to be called brave, if you want to be called smart, intelligent, it is not about using these substances, but it is about staying away from these tough substances and then doing things that are productive in your life. So as a youth, you have to make sure that you are productive to yourself, to your family, to the community, and to the country, and even to the world at large. So this is one of the advice that I have for the youth.
Mr. Ibrahim Wakoli, it was really a pleasure having you here today. You are definitely an expert in health advocacy because the topics have been simplified. You have clarified everything that one needs to know about stress, depression, and anxiety. And some of the main takeaways that I took from your conversation are always share your problems. If you have issues, you can find someone that you trust, share your problem with them. Sharing your problem with them, as Ibrahim said, means they are half solved. And as young people also, we need to, stay away from drugs, seek help whenever we need.